Hello, and thanks for listening to the MiCare Champion Cast. As we kick off a new year, workplace safety continues to be top of mind for those working in our hospitals and health systems. This month's episode will focus on some of the strategies, technology, and proactive measures that can enhance security while fostering an overall culture of safety for both patients and staff. Joining me virtually, I have Brian Uridge, who is Senior Director at the University of Michigan Department of Public Safety and Security, and who oversees Michigan Medicine Safety and Security. He's a sworn police officer for the university and manages over 300 public safety staff members in his role. Prior to this, Brian served as the Assistant Chief of the Kalamazoo Department of Public Safety, where he received the Kalamazoo Public Safety Medal of Valor and Kalamazoo Public Safety Life-Saving Award. He holds a bachelor's degree in criminal justice and a master's degree in public administration. He's a graduate of the FBI National Academy, along with being a board-certified protection professional, a board-certified healthcare protection administrator, and a board-certified threat manager. With that, Brian, welcome to the podcast, and thank you so much for being here.
Well, thank you so much for having me. I'm honored to be here today.
Well, we are certainly honored to have you. How's the new year treating you?
You know, it's been great. It's busy as always. I don't think you really ever have a slow time in healthcare. It's always busy to a certain extent.
Right. That's very true. And especially true during the holidays and respiratory illness season. So I would imagine it's a busy time for everybody in the hospital. But I did provide a little bit of background on where you come from and your current role. But can you just share a little bit more about what led you to this field and specifically what led you to healthcare safety and security?
Oh, absolutely. So I actually started right out of college. I was hired by the Kalamazoo Department of Public Safety. And if you're not familiar with Kalamazoo, it is the largest fully integrated police, fire, and medical EMS department in the entire United States. In other words, everyone has to be all three jobs all at once. So you're a police officer, a firefighter, and a medical first responder. So I went through my career there, and I retired from there. And when I retired, I wanted to obviously do another career because you retire relatively young. So I was lucky enough to get into healthcare security. However, I can honestly say I was utterly unprepared, and I did not know the extent of what I was getting myself into, because when I got into healthcare, much like what the rest of the world does not know, is that the level of violence and the level of things that occur within a healthcare system. And so once I got into healthcare, I quickly realized that in order to keep a healthcare system safe, you really have to use the same philosophies and strategies that you would use in a community to keep a community safe, because really there's no difference. The only difference is that our communities go up, where communities like Kalamazoo or Lansing or Okemos, they go out. And so a simple philosophy that we stumbled into was that every hospital is a community and every floor is a neighborhood. And every neighborhood is uniquely different. And the way that you keep a neighborhood safe is by building relationships with the residents. Well, the way you keep a healthcare community safe is by building relationships with the patients, with the staff, and with the visitors. And it has been such a rewarding career or second career to be into healthcare and to hopefully make a difference.
Right. Well, from what I've learned about what you're working on, I think that you are making a difference. Absolutely. There's no question about it. But I am curious, when you say it's rewarding, what about it is rewarding? We talk a lot about healthcare careers, and we know staffing shortages are affecting all roles within a hospital, clinical and non-clinical. So I guess what would you say to someone who might feel inspired to enter the field that you're in?
Well, it's an amazing career. And much like police work or being a firefighter or medical first responder is rewarding. Being able to make a difference when a patient or a visitor or a staff member is at the hospital is unbelievably rewarding. We need to realize that, generally speaking, someone who is coming into one of our facilities does not want to be there. Unless they're having a baby, they probably don't want to be there. They're there for some health-related issue, and we know that they need assurance. And one of the most rewarding things is being able to make a positive impact and somehow make an exceptional experience for those people that come through the door.
Right.
Probably one of the most rewarding things that has happened in my healthcare career is years ago, we had a nurse who came to us and said that she was a victim of domestic violence and that it was escalating to a point where her partner, she was fearing that her partner would possibly take her life. As security, we were able to help her. We were able to assist her in getting a personal protection order. We were able to assist her in getting additional housing. We were able to give her safety planning. We were able to help keep her safe. And at the end, and I still have the email to this day, she wrote us an email and she said, "How do you thank someone for saving my life? How do you thank someone for saving the life of one of my kids? Today, I lost a member of my family, but I gained a new one at the hospital." And I keep that email with me still today because it is, to me, that is more important than a paycheck, is to make that level of impact on just one person's life. And if I can help do that to hundreds or thousands or and somehow lead a group of people to make that level of impact, that is literally the pinnacle of my career.
Absolutely. You're protecting people quite literally in their most vulnerable moments. So I can imagine that is a very heavy responsibility to bear, but at the end of the day, it has to be really rewarding at the same time.
It really is. And obviously, we focus generally on patient violence, which we know 80% of all violence in healthcare does come from the patients. But then we also have to realize that our own employees are also, they're normal people that are going through the same issues that you and I go through every single day. And they're experiencing sometimes being the victim of crimes, being the victims of assaults, being the victim of intimate partner violence. And all of those things are crucial to help the overall security strategy. And you'll hear me say this more than once, is the key is we've got to make sure that our patient staff and visitors are safe. But just as importantly, we have got to make sure that they feel safe. If they do not feel safe, then we have not accomplished our mission.
That's a great point. Yeah. Well, I'm excited to get more into the specifics of what you're working on, but can you just tee up the conversation, giving us an idea of what's top of mind for your team and really what your priorities are at the moment?
Well, not only what's top of mind for our healthcare institution, but this is really nationwide because it's a systemic issue. And this is another thing that I was not aware of when I got into hospital. But OSHA came out years ago and they had done research and found that 72% of all violence in any workplace occurs in a healthcare setting. 72%.
Wow.
And we know that since then, since COVID, we've seen even a greater increase in violence in healthcare. Depending on what studies that you read, Press Ganey came out and found that there's 2 nurses assaulted every single hour, 24 hours a day. And then if you look at some of the other stats, we know that in a normal work environment, there's generally about 10 people out of every 1,000, 10 people out of every 1,000 are injured because of workplace violence. However, when you look at what nursing faces, that's upwards of 20 to 25 nurses out of every 1,000 are injured because of workplace violence. But then it even increases from there in that we know that psychiatric techs, they have the highest level of injury rate when it comes to workplace violence, and that's 76 out of every 1,000. So we know that our behavioral health units are where we really need to focus a lot of our energy. But then what's unique about this data is that we know that only 26% of nurses who are physically assaulted and only 30% of physicians who are physically assaulted ever report it. So we know that the data that we are investigating, that we are looking at, actually it's actually much higher than what we know. So that's really uncomfortable facts. And again, that's happening throughout the entire nation.
And you mentioned COVID may have worsened instances of violence. Can you speak to why that might be, or any theories you have, or any data you're seeing that explains that?
Well, there's a lot of different factors depending on what report you read. Obviously, people There was a lack of social connection. People are obviously, they were very scared. There were differences in political opinions about COVID and the restrictions, and all of that has led to significant, obviously, spillover violence that's occurred in healthcare.
Right. Yeah. Unfortunately, that makes a lot of sense. And it's a sentiment that we've heard from our members and other experts in the safety and quality space. So, when it comes to these cases of violence, can you tell us exactly what you're seeing?
So nationwide, we know that 80% of all violence comes from patients. Then the vast majority after that is from patients' caregivers, patients' family members, things like that. And that's where we have to do. Remember how I talked about earlier? I talked about the fact that we have to treat healthcare security just like community policing in a normal community. That's where we have to do data analysis, where we have to say, okay, at what point are the assaults occurring? Where are they occurring? Number one, we know that our emergency departments account for 41% of all the violence in healthcare. So we know where, but then we have to look at what point in the interaction do the assaults occur. We know when we do a deeper dive into that, we know that during restraints or walking patients back to their room, those are two primary times. Or we know the number one way that a nurse is assaulted is when she reaches over a patient. So if we know the data at at what point in the interaction the assault occurs, and we know what days it occurs, what times it occurs, that can, just like a community, keeping a community safe, we can do data analysis to hopefully help prevent these types of violent events from occurring, because we know predictable is preventable. Predictable is preventable.
Right, right. And when it comes to that predictability piece, we're going to learn a little bit more later in the show about the behavioral threat assessment that your teams work on. But I do want to ask before that, obviously, we're seeing a lot of advancements in artificial intelligence, and we've talked a little bit about how that's starting to touch healthcare, but we haven't gotten into how it's helping with safety and security specifically. So can you touch on that a bit? And conversely, if you're comfortable talking about where there might be some hiccups or challenges with new technologies?
That's a great question. I'm really glad you asked that. So we're just at the cutting edge, and it is making an incredible difference in healthcare security and in security anywhere. And I'll give you two examples that we're currently using at Michigan Medicine. So we went live probably close to 6 months to a year ago with cameras with analytics. This is artificial intelligence, and these are cameras that are on the exterior of our building that they have a lot of different options. And one of the options, it provides the ability for, if somebody comes up to your building with an exposed firearm, that it can alert your dispatchers and security that there's someone approaching with a weapon. Why is that important? Well, we know the suspect in the Parkland school shooting was on camera for several minutes with an exposed firearm, as an example. Or the suspect in the Uvalde shooting in Texas approached the building with an exposed firearm. So those are all sorts of examples where that's a layer of security. Other things that cameras with analytics do is they can identify anomalies. For example, someone who is loitering in an area. Perhaps I'm waiting outside for somebody, and we'll go back to the domestic violence example. We know that 75% of women who are in an at-risk relationship are targeted at work. So let's say that there is someone that is loitering outside, an intimate partner. It can give you behavioral cues like that. Let's say that there's a physical fight. There's also artificial intelligence and cameras that can identify if you and I are in a physical fight outside, it can identify that. And there's also additional artificial intelligence that can actually track people through buildings. So if you walk in the building, I can track you from camera to camera to camera. So that's just incredible. And again, we're just in the infancy stages of that. But additionally, probably one of the things I get the biggest amount of questions on is, weapons detection, metal detectors, if you will. Well, there's now, and we've gone live with them at Michigan Medicine, we have weapons detection or metal detectors but they not only identify metal, but they also identify shapes and sizes, and they go a step further. So if I walk in and I have something that could be a weapon on me, it will put an electronic box around the location that it's at. And so that we can walk up and quickly identify what that particular anomaly is. And those are just two good examples of where artificial intelligence is really helping keep people safe.
Well, I think whether you work in a hospital or you're walking into a hospital as a patient or a loved one, it would be comforting to know that those technologies exist. So appreciate you sharing a couple examples. On the other side of that, do you have any concerns or are you seeing any challenges with new technology?
Well, absolutely. Obviously with any new technology, there's false positives. And there can be a negative impact on patient experience. We have to recognize that when I come into a hospital, it's a healing environment. That is what the premise of everything that we do. So it's a balance between we want to make sure people are safe. We want to make sure that they feel safe. However, at the same time, we don't want them to feel like they're going into a prison, for example. We want to make sure that we have a welcoming, warm environment that promotes healing while at the same time keeping you safe.
And what would you say the overall response has been so far from patients and staff when it comes to these new technologies? And I ask because I think overall it's a very positive thing. But if you're walking into a hospital and seeing all these new fancy cameras or metal detectors, does it elicit a sense of fear for the fact that you're preparing for those kinds of threats, or are they not seeing the cameras? What does that look like, I guess, is the question.
Well, great question. So you kind of saw where I was going there. So you're absolutely right. So the cameras are completely invisible. Nobody knows it's there. It's a great way to keep people safe. And really, we're using a great system at Michigan Medicine for our weapons detection at our emergency entrances. And really, we're able to clear an anomaly in about 30 to 40 seconds. So there's really been little to no impact on patient experience. Everybody understands it. I would equate it to when you go to the airport now and you take your shoes off or you put your laptop in a bin. You accept that as part of the requirement to travel. I think now in today's society, we accept that we are going to have to go through weapons detection, that firearms aren't allowed in a healthcare environment. And so that's an acceptable change to our patients and staff.
Right. That makes a lot of sense and is good to hear. So in terms of other strategies, what else is moving the needle to reduce violence and enhance safety for healthcare workers and patients?
So we have three pillars of security here at Michigan Medicine. And my staff will laugh because I sound like a broken record. But it really works. And I encourage every one of our listeners, you've absolutely focus on these three and you can never go wrong. It's trust, training, and technology. Trust, training, and technology. And I'll explain. So when it comes to trust, one of the things that we do here at Michigan Medicine is something that we took from Kalamazoo Public Safety. Mm-hmm. So when I was our assistant chief in Kalamazoo, we asked our staff every day, go out and do 15 minutes of foot patrol. You're not there to arrest anybody. You're not there to write a ticket. I want you to get out of your car. And your only job is to go and meet some of the neighbors and interact with them. Even though statistically we know that foot patrol does not reduce crime, but we do know that it builds relationships, it builds trust, and it improves officer morale because they realize, oh, the world's full of great people.
Right.
So we use the same concept here at Michigan Medicine, and we ask our staff every day, go do two incredible things. Number one, go meet a patient that you've never met, engage them in a 3-minute conversation about nothing, ask them where they're from, ask them what the weather is like there. Talk to them about the sweater or the shirt that they're wearing. If you see their license plate on the back of their car, ask them about that. Mm-hmm. And then every day, go meet a staff member that you've never met and engage them in a 2-minute conversation about nothing. It builds relationships. It builds trust. And since we know statistically that the vast majority of active shooters that happen in any facility start with either domestic violence or an adverse employment action, and we go back that we know that 75% of women are targeted at work that are in an at-risk relationship, that's a great way to help keep people safe.
Right.
So that's the number one part, is that trust. The next part is training. We've had incredible success by creating in-house scenario-based training, by collaborating with nurses, with police officers, and with security officers. And we sat down and we created training together, and then we deliver it together. And that's been incredible. And we just use 3 simple premises when it comes to our training. Number 1, situational awareness. How can I stay alert? How can I look for things? How can I look for pre-incident indicators? Proxemics. How can I make sure I create a reactionary gap while still empathetically listening? I'm still de-escalating. I'm still compassionate. But now I'm 1.5 or 2 foot away from Lucy. So I have a reactionary gap. And then finally, de-escalation. We teach de-escalation in everything we do, respectfully being able to listen empathetically to someone and help solve their problem. Right. So it's that trust training. Then the technology piece is really what I talked about a minute ago is, okay, we've got the cameras with analytics. We've got canines that we use. Now our canines, we use them extensively here. We have German Shepherds, Malinois, we have labs. They are not used to de-escalate a patient. They are not used to de-escalate a patient. They are used to reduce your anxiety. They are there to improve patient experience. Yeah. In fact, a quick example of this is we had a patient who was extremely upset with our nurses. He was not listening. He was being very disruptive. So we've asked him, how can we help? And he immediately said, I miss my animals. I miss my dogs. He had been here for an extended period of time. So we said, how about if we go get one of our security canines and you come up and we'll let you pet him. Lucy, it was incredible. He came up, we pet him, we took pictures with him, and it reduced his anxiety, it warmed his heart, and the rest of his visit, he was absolutely the perfect patient. Oh. So that's just an example of using what we call non-traditional community-based outreach in security. That's really a non-traditional approach to keep people safe.
Yeah, I feel like the theme and the thread of those pillars is just like human connection, right? You're just connecting with people, not just in moments of emergency, but also, making them feel safe outside of those moments and breaking the barriers between an authority figure and a patient or an authority figure and a staff member. You're helping those, in the second pillar, you're helping your staff build confidence and training them and helping them understand for their own sake, how they can, what'd you say, protection or prevention is protection. I feel like that, applies to all 3 of those sort of principles. So that sounds like a fantastic model.
Well, thank you. And really it was, I have to give credit where credit's due. There were some great leaders at Kalamazoo Public Safety who really, I just took their ideas and we applied them in healthcare. I don't think I've ever come up with an original idea in my life. But I had great people that were my mentors that I learned from. And all we did in Kalamazoo was build relationships with community members to build trust. And we apply the same thing in healthcare, and it works flawlessly because people don't care how much you know until they know how much you care.
Absolutely. Yeah. And it's a people first approach, it sounds like.
Absolutely. And some of the training like home health. We know home health is growing exponentially, sending people into the home. In fact, we will, by 2029, we will have added 1 million in the country, 1 million jobs to in-home healthcare. So we created a first of its kind scenario-based training for our in-home healthcare workers. And it's gone so well, become so popular that we've had at least 10 other states come out to ask us about the training. And the training is called REACT, Rapid Environmental Assessment Control Training. How can we help our caregivers who go into the home to feel empowered and to make sure that they feel safe and that someone cares about their safety?
Absolutely. Have you gotten a lot of positive feedback from that?
Yeah, it's been incredible. It's, I'm such a proponent of good training. It's something that it not only, as I know I sound like a broken record, it keeps you safe, but it would make sure that you feel safe. And feeling safe is just as important.
Yeah, being proactive in that is probably really key to what you do. So just to switch gears back to something I mentioned earlier, obviously we are continuing to see a lot of violent events occurring around the world and, a lot of scary headlines. And that tends to create fear and anxiety in people, whether they're inside or outside of the hospital. But before today's call, you had mentioned behavioral threat assessment. The acronym is BTAM. Is that right?
Correct.
And can you just talk us through what that is and what the value is?
Oh, absolutely. So at a high level, and you're absolutely right, our nation's anxiety level is up so high. Look at what happened to the CEO of United Healthcare. Look at what happened down in New Orleans. We've got an incredible tragedy unfolding in California. And although what we haven't talked about is what is the impact on all of those healthcare organizations out in California, which have to be overloaded with patients.
Right.
So that's a big thing. So when it comes to the United Healthcare situation or behavioral threat assessment, what we have here is, and you'll see this everywhere all over the nation, it's behavioral threat assessment and management, and where you're looking to identify, assess, and manage behaviors of concern. People who are on what's called a pathway to intended violence, will generally leak information. They will exhibit behaviors of concern. They will exhibit what's called pre-incident indicators. And what behavioral threat assessment does, it's a multidisciplinary approach. In other words, we're going to have multiple people from all different disciplines who will sit down and they'll say, okay, Brian is exhibiting certain behaviors or perhaps I've posted something on social media and it's concerning. We know that obviously when we look at what happened with the United Healthcare person, that suspect had not directly threatened that CEO, which we know statistically people who are actually going to commit violent acts will not directly threaten the person, but they will generally leak information to a friend or a coworker or a domestic partner. And so it's those types of things. What we're trying to do is support people. We're not looking to arrest people. We're looking to support people who may be going down a pathway to intended violence. And really everyone follows the same pathway. You've got a grievance. I'm upset about something that has occurred. I'm very, very angry. And then I'm going to have ideations. I could commit an act of violence. Now, if I'm thinking about committing an act of violence, Gavin DeBecker, who's the foremost expert in these types of behaviors, comes up with something called JACA. And everyone who's considering violence will go through these 4 things. Am I justified? Do I have alternatives? Can I deal with the consequences? And then do I have the ability? So as I'm thinking the ideation, then I'm going to do planning and research. Okay, I'm going to look at where might I go? We know in the case of the CEO who was shot at United Healthcare, that suspect had arrived a week earlier, 10 days earlier. So they had done research. And then they'd done preparation, obviously purchasing of the weapon, things like that. We know that there was writings on the shell casing, things like that. And then obviously the attack. So our goal in threat assessment and management is to identify those behaviors, assess those behaviors. We're not looking to predict behavior, but we are looking to prevent. And how do we prevent someone from doing that? Well, what are the different areas that we can support that person? Can we get them into counseling? Can we identify one of their loved ones or coworkers or mentors to help guide them through this behavioral crisis that they're going through? So that's really at a high level what we look at with threat assessment and management. And you're seeing these pop up. They've been around in schools now for years, because we know when it comes to school violence, again, those would-be suspects will leak information to a coach, to a fellow student. So we need to identify those behaviors long before the critical incident.
Right. And can you speak a little bit more to the integration between law enforcement and mental and behavioral health care? Because I think that what you're talking about really integrates the two. And I'm curious to hear more about that.
Oh, absolutely. In fact, there's something called crisis intervention training, CIT training, which has really become very prevalent in law enforcement. And we did it years ago in Kalamazoo. We trained multiple officers in crisis intervention training. And as I would sit in my office, I would hear on the radio people say, they'd get on the radio, could you send me a CIT trained officer? Can you send me a CIT trained officer? So I pulled a couple of officers in. I said, well, tell me about this training. And they said, Brian, it really works. It really is beneficial. So anytime we can have that behavioral health, mental health support and partner with those experts, whether it's law enforcement, whether it's security, whether it's in a behavioral threat assessment team, and keep in mind, those partners are always part of a multidisciplinary threat assessment team. That's key.
Right. Yeah, absolutely. And where do you see the greatest challenge when it comes to integrating the behavioral threat assessment and management?
Well, the biggest thing is first developing it, number one, creating policy around it, and then making sure that there's awareness around it in your healthcare community, so that people know that Lucy knows, you know what, Brian's exhibiting some behaviors, but I know that I can call this number and I can get the support that he needs, because we can put a team together. And one of the things that we do, we call it a protective investigation. So Dr. Lucy may be the target of some type of threats, or there's a patient who is no longer a patient who is sending inappropriate messages to Dr. Lucy. So what we do is, first and foremost, we'll do a behavioral threat assessment. We'll look at, does there need to be a criminal investigation? We'll look at what can we do about a physical vulnerability assessment of her office and her home. We'll look at safety planning, one of the things that are so often overlooked. If Lucy changes her time to work by 10 minutes, if she changes her route to work by one street, she changes where she gets coffee in the morning by a different coffee place, all of those things help prevent you from being a victim of targeted violence. And then obviously training, and one of the biggest things are those non-traditional contacts. We'll follow up with a canine visit, and all of those is really a holistic way to keep you safe and ensure that you feel safe.
That's amazing. And have you gotten, I feel like I've asked this with a lot of the things you've mentioned, but what has the feedback been?
Oh, the feedback's incredible. The feedback is incredible because in my mind, it's a customer-focused approach. Our goal is to create an exceptional experience for every patient, every staff, every visitor. And the simple way I explain it is, if somebody asks for 5 pounds of something, give them 10. If somebody has an issue, I don't care where they are in the state, we will go and follow up with you in person. Wow. We had a situation out at one of our Muskegon locations, and first thing we did was, we're going to go there in person. And then we did staff training out there early in the morning before they opened up with all their staff. We did it in their waiting room. Videos, the whole thing, because people don't care how much you know until they know how much you care. And that's that in-person follow-up, and it makes such a difference.
Absolutely. That's incredible. And are there any other efforts underway at Michigan Medicine and in the safety and security space specifically that you'd want to share with our listeners?
Well, I've kind of driven it home over and over again. Really, it's that trust, training, and technology. And this is an old book, but I really encourage all of the listeners to read it. If Disney ran your hospital, 9.5 things that you do differently. Have you ever read the book?
I have not.
It's an incredible book about using the same philosophies that Disney uses to create exceptional experience for patients, staff, and visitors. So for example, on page 3, you can tell, I make every supervisor read it. Page 3 of the book, it says very specifically, the number one patient need is assurance. The number one patient need is assurance. And we know that custodians, or whatever you refer to them at, we call them EVS, environmental services, they have more face time with a patient than a physician. So if we can train our EVS/custodians on how to provide an exceptional experience, on customer service, on that front facing, you can make an incredible difference. We know that customer loyalty is created by doing things that people don't expect. And if you can do that, you can take someone who doesn't want to be here anyways. They don't want to be in the hospital. They could be suffering, or their loved one could be suffering from a life-changing diagnosis. That's our opportunity to make a difference in their life. And then we have to make sure that we're not doing things in a vacuum. We've got to make sure that when we're looking at security enhancements, that we're bringing in nursing, that we're bringing in physicians, that we're bringing in EVS, that we're bringing in clerical staff to understand how it impacts all of those different stakeholders, so that we can make a positive difference for everyone that comes into our health system.
That's amazing. And just to build on your alliteration, I know you had one for the pillars, but I feel like everything you've talked about is a mixture of culture and communication and collaboration. So I'm giving you that as another, I'm an alliteration fan. So if you want to add it to your toolkit.
No, I will for sure. Remember, I've never come up with an original idea, so I'll steal that all day long.
Steal it.
But it really is about culture. Yeah. And people are so frightened by what they see in the media. Now, we know that mass shootings, for an example, account for less than 0.5% of all homicides in the United States. So it's an extremely rare event, yet it's the number one thing people want training on. Well, if we know that, we need to look at, okay, what other training can we really give people to make sure they feel safe and are safe? And that's where we created like situational awareness and personal safety. It's a training specifically designed to keep you safe before work, during work, and after work. But it also builds relationships. It builds trust. Then there's follow-up. And all of that lends into that culture piece that you talked to a second ago.
Absolutely. Absolutely. And I just want to thank you again for being here today. You've shared so much wisdom, and I want to give you an opportunity to let people know where they can go to learn more. But before I let you go, I do want to ask, is there any advice or wisdom that you'd pass along to others in your field?
Well, I think you've really already hit on it in our last couple of minutes. The biggest advice I can give, especially my security partners, is remember, it's ambassadors first, security second. It's ambassadors first, police officers second. People are calling us on what could be their worst day ever. People who call 911 or who are calling the emergency line in the health system, it could be one of their worst day ever. Remember, our goal is to provide an exceptional experience. Our job is to reduce their risk and to reduce their anxiety. And we do that by building trust, by working to collaborate to create scenario-based, high-speed, low-drag training, and then using technology like cameras, like weapons detection, like canines, to help reduce all of that anxiety. And that's how we really need to look at healthcare security.
Absolutely. And where can, patients of yours, but also just the general public or anybody that maybe would be interested in collaborating with Michigan Medicine, where can they go to learn more about the work that you're doing?
Yeah, probably the biggest thing, they can go to our DPSS website. They can email me direct. I don't know if you're going to put that in the, so hopefully you'll put it in the podcast. Please feel free to email me direct. Absolutely anything that I've talked about, any of the training that we do, we will give you for free. We will help you do it. We did training for and let them record it for all of Henry Ford. Everything that we train on is open source. Everything comes from published research. We want you to steal it. We want you to put your own name on it. We've created video. We've got great attorneys here who let us share our videos. We have 5-minute training videos that our attorneys have let us share. Just give us a little bit of kudos when you do it. So any of that, get with me directly and I'll be happy to share it with you anytime.
That's incredible. Brian, thank you so much for being here today. I'm excited to share this conversation and share all the resources that you've passed and wisdom that you've passed along.
Well, thank you very much for having me.
With that, I'd like to thank our listeners for tuning in, and as always, encourage you to check out the description of the episode to learn more about the resources mentioned. To learn more about Brian and the work of his team, head to dpss.umich.edu.